The role of vitamin D in healthy bone growth and maintaining adequate levels of calcium in the blood has long been acknowledged. But in recent years, vitamin D has become the darling of the medical community as more of its contributions to human health and longevity come to light. Obtained from sun exposure, certain foods, and supplements, vitamin D helps nearly every part of the body. Recent studies suggest that inadequate blood levels of vitamin D may be to blame for certain cancers, neurologic and autoimmune diseases, and most significantly, metabolic syndrome. Metabolic syndrome is a constellation of maladies characterized by a large waist-to-hip ratio, high blood triglyceride level, low LDL, the healthy type of cholesterol, high blood pressure, and high fasting blood sugar. These disturbances in metabolism can place a person at as much as a 5-fold risk of diabetes, heart attack, and stroke. A study at the University of California in Sacramento compared vitamin D levels of people with metabolic syndrome with a control group of healthy adults. 30% of those with metabolic syndrome were deficient in vitamin D, compared to only 8% of the control group. One possible explanation for that, because vitamin D is fat-soluble, it tends to get sequestered in fat. Therefore, people with metabolic syndrome who tend to have higher percentages of body fat may place themselves at risk for deficiency. What happens if you don't get enough vitamin D? In extreme cases, deficiency causes rickets in children, where the bones become so soft they actually bend. This is fairly rare, but we've seen this in Middle Eastern countries where young girls are forbidden by their religious culture from leaving the house without a burqa covering their flesh from head to toe. During the Industrial Revolution in the US and England, the absence of child labor laws allowed even very young children to work 12 to 18-hour days in factories where they virtually never saw the sunshine. These kinds of extreme deficiencies in children have been largely eradicated by the addition of vitamin D to milk since World War II, as well as the widespread use of supplements. However, recent research indicates that we may have grossly underestimated the effect of milder forms of the deficiency. Most common are adult deficiencies of this vitamin, which can result in osteoporosis, a painful condition wherein the bones become porous and brittle. Muscle weakness and joint pain can also occur. Vitamin D is obtained most expediently through sun exposure. Only a few foods naturally have vitamin D. The best sources are fatty fish like salmon and tuna. Smaller amounts can be obtained in beef, liver, cheese, eggs, and mushrooms. Many foods are now supplemented with vitamin D, such as cereals, milk and other dairy products, margarine, juices, and soy beverages. Supplements in pill form are widely available. Both vitamin D2 and D3 will raise blood levels of vitamin D in the body, but most sources indicate that D3 is the more effective of the two. Conventional wisdom holds that getting 10 to 15 minutes of sun exposure per day with hands and face exposed allows the body to synthesize adequate amounts of vitamin D. But wouldn't you know, it just has to be more complicated than that. In the winter months in the northern United States and Canada, the sun simply isn't strong enough to make any vitamin D at all, even if you stayed out all day. Also, the older you get, the longer you need to stay in the sun to reap any benefits at all. People with dark skin, obese adults, the elderly, and those with certain digestive disorders like Crohn's disease or celiac disease are at the most risk for deficiency. In a position paper by the American Academy of Dermatology, they firmly recommend that adequate amounts of vitamin D should be obtained exclusively from dietary sources, including foods and beverages fortified with vitamin D and/or vitamin supplements. They assert that there's no scientifically validated safe level of ultraviolet exposure from the sun or tanning beds that allows for optimal vitamin D synthesis without increasing skin cancer risk. The Academy further urges physicians to provide information to their patients regarding vitamin D supplementation. Current supplementation guidelines hover between 400 and 800 IUs, or international units. Scientists have been forced to reassess the amounts of this vital nutrient necessary for optimal health due to evolving research. Several sources believe doses of 2,000 IUs fall well within the margin of safety, with doses of up to 4,000 IUs indicated for certain populations. Toxic levels of this vitamin can trigger nausea, vomiting, disorientation, and heart problems. It is, however, impossible to achieve dangerous levels of vitamin D that is synthesized in the body from sun exposure. For Endless Youth and Life, I'm Jane Morse.